Welcome to the latest in our series of conferences exploring the effect of COVID on the social care sector, looking back and moving forward. For this edition, we turn our focus to the adult learning disability and autism sector, looking specifically at how the sector is evolving for a brighter future. I'm Brendan Ryan. I'm the National Specialist Director for Social Care at Hays, and it's a great pleasure to welcome everyone to this session today, to what promises to be a thought-provoking and interesting hour and a half of presentation and debate. Particularly want to extend our thanks to the panel of experts being very generous with their time and expertise and make these events possible. So on behalf of Care Talk and of Hays, thank you very much for your involvement today. Before we do move on, and before I pass over to our chair today, Catherine Smith from Sky, just want to share with you a couple of bits of information from both host organisations, Hays and Care Talk. Firstly, from a Care Talk perspective, nominations are now open for the Learning Disability and Autism Awards. I think the closing date, you can see on the slide in front of you, the 16th of August. And this year, more than ever, it's hugely important to recognise the great work that goes on in this sector, and this is really important channel in which to do that. So please, if you haven't nominated already, please do so. Also later this year, and this will be a great opportunity to come face to face and have these types of conversations. Care Talk are hosting a conference in London on the 30th of June at the Mermaid Centre in association with Sky. And so you can see the details of that on the screen here, from new normal to new future. So if you're interested in finding out more about that and seeing how you can get involved, details can be found on the Care Talk website. So please do have a look at that. And finally, for any of the participants today who also have a interest in the children and young people's sector of care, just to flag that the nominations for the CYP event awards, which take place on the 22nd of October this year, are also open. So plenty of different award categories to nominate your staff and organisation for. So please do have a look at that. Finally, I just want to raise awareness of the recently released earlier this month, Hays Social Care Salary and Recruiting Guide. So this is the results of a salary survey that was taken right at the peak of lockdown. Gives some really interesting insights into the recruiting trends that are developing as a result of COVID, potentially will develop in a post-COVID landscape. There's key findings, the statistics, and clearly in a salary guide you'd expect to see some salary information as well. So all that is available. If you do want to request your guide, please log on to hays.co.uk, salary-guide /social. Put in your request and we'll arrange to get a copy of that. So that's probably enough from me. It's time now to hand over to Catherine Smith, who is our chair for today. For those who haven't been on these events before, Catherine's the CEO of the Social Care Institute of Excellence and acts as our regular chair, a job which I'm really pleased that she does, because it helps these events and proceedings move along really well throughout the course of the call. So Catherine, over to you.
Thank you, Brendan, and welcome everybody to this event, which I'm sure is going to be really interesting and fascinating. We've got a fantastic lineup of speakers, as you can see there, and as we get to each one of those speakers, I'll give you a little bit of introduction to them. We are expecting Cecilia first, but unfortunately she's not here yet, so we may have to come back to Cecilia, and then we'll go through. We've got Jim and then Jonathan. Then we've got an opportunity for questions and answers to Jim and Jonathan. I should have mentioned Scott with Jim, sorry. And then in the second half, we've got Rachel and Yvonne, and another opportunity for some more questions and answers. So that's me when hairdressers were still open. Yes, as Brendan said, I'm the Chief Executive of SKY, the Social Care Institute for Excellence, and we're working with Care Talk on these conferences and on the face-to-face conference that Brendan mentioned in June. If you haven't already got your tickets, then do get a ticket bought for that. I'm really looking forward to that event, and it should be a really, really good one. So we'll move on. I don't think we've got Cecilia. I'm just double checking. Has Cecilia arrived? I don't think she has yet.
Not yet, Catherine, no.
No, okay, well, we'll hopefully be able to come back to Cecilia later, but in the meantime, I'm just going to introduce Jim Blair and Scott Watkin. So Jim Blair is chair of the Royal College of Nursing's London Board and is an independent consultant nurse learning disabilities. And I actually had a message from one of my colleagues this morning about Jim, who told me that he is the learning disability nurse and has been fantastic with his son. So there you go, personal reference there, Jim. And we've also got Scott Watkin, who was the co-chair of the Learning Disability Partnership Board on the Isle of Wight and chaired the partnership board for 6 years. Scott took a national role with the Department of Health in May 2009 as the co-national director for learning disabilities until June 2011. I actually had the opportunity to meet Scott at that point, but I expect you met loads of people, so you wouldn't remember me, but very impressive. So I'm going to hand over now to Scott and Jim, who can talk you through their presentation. Thank you.
Hi, thank you, Catherine. Good morning, everybody. Hi, Scott. How are you doing?
Yeah, I'm good, thanks, Jim. Hello, everybody. How are you all today?
I don't think they can respond, but I hope they're all right. And I hope they're going to enjoy what we're going to talk about. We're going to do a bit of a double act. It's very serious topics we talk about, but also we hope there will be some sort of takeaway messages that you can clearly take away from today. So what we're going to talk about is small actions by lots of people making big change. And the topic we're focusing on is healthcare, COVID and beyond, health and well-being. So, Scott, I'm going to talk a little bit about some of the things about learning disability nursing first, and then we're going to have a chat with you and I, just sort of talking about what's been happening in COVID times for people like yourself, as someone with a learning disability and a parent as well, and some of the challenges that you faced and other people have, and then some of the solutions, both locally and nationally, that we're going to talk about. Because those who know both Scott and I, we're very solution focused and outcome orientated, and making sure that people get the right care in the right way in the right time. So this is a really bright picture, and this is kind of the roles that learning disability nurses do across and within our sector, within community health and social care and education provision. I'm not expecting you to read all of those, but it just shows you that there's a huge array of opportunities for people to work within learning disability nursing and also provide the care and support. And it's really nice to hear that Catherine's colleague said that about me. That's really nice, and I'm sure that that's reflected from many people that have had contact with learning disability nurses. So it's good to hear that. So what are the key roles of a learning disability nurse? Well, this is my vision and my framework for what I think learning disability nurses must, should and need to be doing. So they need to be focusing on addressing diagnostic overshadowing. That's when you put something down to a person's disability rather than looking beyond that. So, for example, I'm a white guy who's 53. If I go and smack my head against the wall, do you just think, well, that's what white guys who are 53 just do? No, you probably don't. And you'll probably explore behind that. Whereas sometimes people don't do that if you throw the learning disability into that. So I could be a white guy, 53, and I've got a learning disability. People put it down to the learning disability rather than actually thinking beyond that and exploring mental or physical health issues. So that's what we're going to talk about today as well. Then we've also got the health issues and how they present for people with the learning disability. Often people don't tune into somebody's frequency, look at issues around pain, discomfort, behaviour change, why that might be and what's going on for them. Learning disability nurses can help tune into that frequency. But right in the centre of the hand is the most important part, and that is engaging families and people with learning disabilities in the care evolution and how we can move things forward. And you're going to hear very much from Scott and myself as we go forward, how we are going to, we suggest that should be done. And considering we're talking about it, we're happy to help move that forward as well. Then there's the education and action part of learning disability nursing practice. And that is about modelling and shaping good practice across and within all services to ensure and improve the health and well-being of people with learning disabilities. And the fifth finger is what Jonathan Senker is going to talk about a lot later on. Jonathan's the Chief Exec of Voiceability, and that's about understanding the rights acts and ability to really make sure that people get the right care, the right supports in the right way, and in a lawful way as well. So during the COVID times, learning disability nurses have done a variety of different things, and I'm going to let you to read through some of those things. But what do you think have been some of the most important things that learning disability nurses have done during this time, Scott? What do you think we've done over this time?
So I think you've been able to advocate on our behalf and to being able to support us to get the right healthcare needs that we need. I think what's been really important is that you as learning disability nurses really understand us. You know how to communicate with us, and you know the different models of the way into communicating with us, and also you're able to support the professionals, the doctors and nurses who don't understand people with learning disabilities to really think differently and to think outside of the box and not just ticking a box.
And I think some of those things that we talked about, we can see here, the virtual health clinics and other things like that have gone on, the COVID system checkers, the way that people, learning disability nurses have set up and adapted vaccine clinics and being vaccinators themselves. So they're giving the injections for people with learning disabilities, preparing and shaping what that would look like for them. And learning disability vaccine clinics are really important because it's enabling people to have it in a nice, relaxed environment and in a safe and refreshing way. So those are the slides will be shared later on. So I'm not going to go through all of those, but it gives you a flavour. Whilst we've been talking, you can read some of those things as you wish. So now this puts us really nicely into the heart of what we're talking about today, Scott. So from your point of view, Scott, what's it been like the last year for you and for people that that have a learning disability?
It's been difficult. It's been lack of accessible information for us all, and not knowing the rules around what we can do and what we can't do, and whether we're allowed to go out or whether we're allowed to stay in. Government have really not been clear around what making the reasonable adjustments for people with learning disabilities and shielding. I mean, that in itself is, some of us got letters, some of us didn't. I didn't get a letter, nor did my wife, about shielding. And that wasn't even in an easy read format or an accessible format for people. I mean, at the beginning of the pandemic, I had to walk 40 minutes each way to go to collect my shopping because I could not get an online shop because everybody was panic buying. And actually, when you've got a family, you've just got to do it, haven't you?
Definitely, you have got to do it, Scott. And I think one of the other things that's really come up, and we've all seen it recently, is about sort of this idea that, should people with a learning disability have been put at a higher priority on the COVID list for treatments, but also for the vaccine elements within that, and also following up. What do you think about that?
I think we should have been put higher up on the agenda for treatment and the vaccination. I don't think we should have had to have fighted as much as we've had to fight, and and actually I think it is really about it just shows the lack of experience and flagging of government and the NHS of what
Mm.
they don't always know about how to treat people with learning disabilities. We don't want to be treated special and we don't want to be treated any differently, but actually we're just as vulnerable as everybody else. And
Yeah, I think that's a really important point. Yeah, that's a really important point. And your last bit there, we just said, and I think I didn't mean to talk over you. The unfortunate thing is sometimes there's a time lag, but you talked about the equality, and you're right. I think that the issue you mentioned about flagging as well and alerts. Some people think it's a label and people shouldn't be labelled. The issue about that is that label saying, you know, who somebody is and the issues that they're facing, just in a line, is only seen by those in healthcare, be it in primary and in the general hospitals. So it's really important that that actually happens, because we know that there's only 150,000 people approximately on the learning disability GP registers at the time of the pandemic, when the vaccine was going to be rolled out. And yet there's over 1 million people, about 1.2 million people with learning disabilities within the population. So there'll be a whole lot of people who've missed out on that. So one of the things, what do you think about yourself having being on a GP list and being noted in your local hospital as having a learning disability? Do you think that's a good thing, a bad thing, or you're just not sure?
I think it's a good thing, to be honest. I'm not afraid of people knowing what my learning disability is, how I need to be treated, and the way people need to communicate with me. What I wouldn't want them to be doing is treating me any differently to anybody else, though, and that's key. I think for each person, it's about making a reasonable adjustment and working with each person in the way and giving them the treatment that they need in the way that they need the treatment, not
Yeah.
and not treating everybody with a learning disability the same, but and not also it's not always about ticking a box. It's about thinking
Absolutely.
outside of the box and treating us like human beings.
Absolutely, Scott. I think that's a really vital point. And the bit you were saying is about not being treated differently. And I think what I'm getting from that is that, you know, equal treatment doesn't mean to say treatment should be the same. Adjustments in order for people to actually get the treatment they need. Sometimes we do need to make changes for somebody. That doesn't mean that you're treating them in a less or a better way. What you're doing is, well, hopefully you're treating them a better way, but what you're doing is you're focusing on what needs to change for that person, for them to be able to get the treatment that they need and move forward. So, and I've left the slide up so you can read it at the same time as we're talking, but really things like, if you don't have people on these registers and the GPs and the hospitals going forward, they will not get the care and treatment they rightly deserve, and we will see preventable, avoidable deaths happening. This is the way to tackle it. If you don't do it, we won't get the change that we need and people having healthier, happier lives. So just thinking a bit about that, some of the issues that face with people with learning disabilities are referral to treatment. This is a busy slide, but don't worry about it, because you can get the pack if you wish. You can see it later, and I talked more about it in articles and stuff like that if you choose to read those, or you can contact me and we can talk about it. But the referral to treatment, so that's the time from having an appointment with your GP to actually having the treatment within a hospital setting, is much longer for people with the learning disabilities. So we need to tackle that. And having learning disability nurses working in primary care and in hospitals can do that, as well as within the social care services themselves, making sure that people are picked up, and behind every behaviour change, always consider a physical or mental health reason and act. Ensuring that there's effective outpatients appointments, which often break down because people are frightened, worried and scared, understandably, as well as being ill, when they go into these settings, and they're not built and geared towards the individual. So it's about being able to understand somebody's needs and making sure that things can be adapted for that person. And people with learning disabilities tend to stay in general hospitals longer than those without a learning disability. Now, this can change, and learning disability nurses are instrumental in shifting that. And I and others have written a lot about those things. So if you want to pick up on that elsewhere, you can. And having learning disability nurses in primary and acute and linking up very closely with colleagues in the social care sector will reduce the readmission rates. So it will stop people coming back in too quickly because things haven't been put in place on the discharge. So it ensures better discharges from hospital. But right at the core of all of these things are the people with learning disabilities, the families themselves. And we're going to talk more about that right now. So, Scott, when we first met, I remember it. It was a very memorable day. You've got a fabulous sense of humour, and we've been friends ever since. I think it was probably about 2007, 2008. And then, you know, we met again more when you were in your post as the co-national director for learning disabilities. This is an idea that we've bubbled up around for a while. Why do you think we need 3 co-national directors for learning disabilities? One, an individual with a learning disability like yourself, another person, a parent or somebody with family experience or a sibling, and the other a professional. Why do you think that's important?
I think it's important because actually we're seeing very much lack of leadership and lack of people's voices being heard in the at the centre. Whilst when I was working at the Department of Health, there I'm representing people with learning disabilities and their families, I was able to make sure that professionals, ministers, civil servants all stood up and actually listened to people. I think the biggest issue was when they took away the structure of having nobody with lived experience and no family members really involved and just left it as a program board, then you knew for a fact that it was going to go backwards. We were not going to get our voice heard in the same way as we have.
So what you're saying, Scott, is that actually, you know, having 3 like that, and what I think is really important for the audience to realise is that what we're suggesting is a model that weighs heavily in favour of people with lived and living experience. So there'll be 2 co-national directors who are not professionals. So someone with living experience with who has a learning disability, and a person, a parent, family member of people with learning disabilities involved in that, and then a professional alongside that. We've also discussed about this new evolution that we think should happen. It's like this quality monitoring improvement panel made up of 51% so people with learning disabilities, 34% family members, and 15% professionals. Why do you think that's important? And what message would that say to to those with learning disabilities and their families and the wider society, and how would improve lives across the country?
So I think people with learning disabilities and families will have more hope and in getting their voice heard nationally throughout the country. I think it also will say to professionals, actually you need to take us seriously and really understand us and really listen to us. I think too often what happens is we'll sit in a meeting, we will tell them as it is, and we'll be frankly honest and open with them. The professionals will all say the right things. Oh yes, we get that. Yeah, we really understand that. Yeah. Like and then they'll go and say, oh well, we'll go away and do something about it, but in reality nothing happens.
And I think that's a really shocking reality, isn't it, Scott? And that's your experience going forward, but the experience, as you say, for other people that you know that have a learning disability as well. And I think the panel that we're suggesting, if you look at the makeup again, the weight of the makeup of the panel is not in favour of professionals. Sadly, I think we see still far too much where the makeup of organisations, of panels and stuff like that, throughout an organisation, from the board to the floor and back again and everywhere else, is weighted more still in the professional favour. This doesn't do that, and the responsibility would be that actually those members of the panel would be accountable and responsible for what's going on. So there's a vested interest in making sure change happens, and you've been able to look at the slide as we've spoken. So I'm going to move on to, I think this is near the end of our slide. How would we want to see the panel being approached, and what would we like to see them do? Well, it would be an idea approach. Well, actually, it'd be ideas, and the S would be solutions. I just lost that off because Scott and I just believe in solutions anyway, so we should have just put that in there. But we'll make sure we change that before we publish this in different journals. So the idea is about information gathering, decision design, engage and involve, and then the action. And then following that, it's the solutions and monitoring that throughout. That's what's really important. And at the heart of this is not people like me, because I know that much about learning disabilities and being a person with a learning disability, because I don't have a learning disability and my daughter doesn't have one. So I'm not a parent and I don't have lived experience. But when we put it together with everybody, we get a much wider, better picture of people's reality and lives. That's when we can make changes really happen. And Scott, just before we actually finish, we know that we both want to see this action happen and change, and we both know it can happen. What do you think really what would you say is the take-home message you want to give to the people listening in on this, and those decision makers and policy makers, ministers that may be here with or without their Union Jack flag?
Sorry, that just made me laugh at the end. So I think actually it's about really putting yourself in the person with a learning disability shoes and the family shoes, because you don't live it, you don't breathe it every day, and you don't have to have the challenges that we have every day. I always think to myself is actually, what is that person without a learning disability doing? Are they going home, having their glass of wine, having their dinner, not and are they able to switch off from everything that's going on? And I believe that actually that's what they are doing. But actually, for a person with a learning disability, once you go home after your shift, whether it's in social care, whether you're treating somebody in hospital, whether you're whether you're deciding what funding you're giving somebody, you're going home, you're having your dinner and you're having your wine, or if you're not drinking, your orange juice or your pint of beer. But actually, for the person with a learning disability, they're still having, and the family, they're still having to do the support and to make sure that they can live and enjoy their evening, just like you are. But actually, with, I suppose what I'm saying there is that actually it's all about actually, my words are gone.
It's about real change, isn't it, Scott?
Yeah.
It's about what we talked about a lot, about what we've talked about here today, and I hope people have really got a good message about it. And it's what Scott and I will be fighting for alongside others, is actual real embedded change. Systemic change needs to happen, and COVID has told us that things aren't going right as it is. So we need to shift, and we can shift, and the solutions that we put forward today are those that can happen. We need to make sure that the structures are built around, with, for, and together we can change that. And the action needs to happen now. We need to improve supports throughout the country. We need to reduce the elements of poor housing and the issues around poverty. These are really important, but if we're going to make these changes, we've got to have a panel like that. We've got to have 3 co-national directors, as we've said, and then we can get a correct direction of travel to move forward. That's my last word. What's your last word, Scott?
I think you just got to do it. We want to see action. We don't want to see another report sitting on a shelf, creating dust, and saying, sorry, we've learnt lessons. from making a poor care decision. We want action now.
Thank you, Scott. Been great to have a chat with you today, with everybody here, and thank you all for listening to us.
Thank you, everybody.
Thank you so much, Jim and Scott. That was brilliant, really thought-provoking, and some good ideas for us to take away for action as well. Look forward to seeing this coming out more. If anybody's got any questions for Jim or Scott, put them in the Q&A box. I can see we've got one already, but if anybody's got any more, put them in the box, and we'll be coming back to some questions and answers shortly. In the meantime,
Have we lost Catherine? Can someone from the panel let me know if I'm the only person who can't hear Catherine?
No, I think we lost the temporarily.
sorry, can you not hear me?
Oh, we can hear you now. Temporarily, you dropped out, Catherine. I'll pass back to you. It's okay.
Just gone again.
Oh, okay. Whilst Catherine overcomes whatever technical problems of Setter, let me take the opportunity to introduce our next speaker, Jonathan Sanker, who's the Chief Executive of Voiceability. Jonathan, welcome to the panel, and over to you.
So thank you, Brendan. Can we move the slides on? I don't have a pack, so you just have my face, I'm afraid. Thank you ever so much, and really delighted to get the chance to speak with you today. And wow, Scott, Jim, I think you really nailed it. That was phenomenal. Thank you for that. I'm the Chief Executive of Voiceability. Voiceability, we aim to make sure that everyone has a voice when it matters most in their lives. We work alongside people with learning disabilities, alongside autistic people, people with dementia, people with physical impairments, children and young people in local authority care, and many other people. I'm also the older brother to Juliet, my sister, who has learning disabilities and autism. So as Scott, I'm having not beer or wine, I'm afraid, something much more lightweight in the evening. I certainly don't leave these issues behind. It's not just a day job. I think at Voiceability, we see a really big gap, and I think Scott and Jim really illustrated that, between the kind of happy, healthy, good lives that people have a right to expect and the reality. And we work to help people to bridge that gap, one person at a time, through our individual advocacy work, and we're a leading provider of independent advocacy in the UK, also through supporting peer-led support for people. So working to make sure that we bridge that gap between the lives people have a right to expect and their day-to-day reality. I think that, and Scott and Jim again have I think really nailed this. The last year has drawn into really sharp focus everything good and everything bad about how it is that we support and enable people, and how we are as a country. The good, and I pay huge tribute to the work of providers through the pandemic, the work of families, the resilience of people themselves through it. The bad, the kind of inequalities that Scott and Jim have described, battle for vaccination, problems in getting people equal treatment, lack of support, lack of information. I think we need to use the pandemic as a wake-up call to make real change in people's lives. So completely agree with that need for action. I'm going to talk over the next few minutes about 3 key opportunities that I think we have to do that. Social care reform, transforming care, and I'll talk about the Mental Health Act in connection with that as well, and the liberty protection safeguards. Starting then with social care reform, there's a lot of talk about how's care for people in older age funded, how's social care funded, how do we make sure that we make sure there's the investment needed, and that's all very important. But actually, I think we need to start somewhere quite different. I think we need to start with what it is that we're trying to achieve here. And that's been described really well by people like Social Care Futures. And they've said things like, we all want to live in a place that we can call home, with the people and things we love, in communities where people look out for one another and people do the things that matter to us. That's the description from Social Care Futures. Completely endorse that, and I think we need to keep that in mind as being a real starting point, a real aiming point for us. And when we think about what we've learned over the past year, what we've learned over the pandemic, I think one of the things that we've really learned about is how we can use, how we can galvanize communities to truly support one another. I'm reminded back, gosh, what is it, 40 years ago, 41 years ago, the King's Fund came out with a publication which was really influential. It was called An Ordinary Life. And what it set out was that people with learning disabilities should be able to live in ordinary houses and ordinary streets and be a part of the community like everyone else. And I think we've made huge strides in that direction. And I really commend people around this conference who I'm sure have been a part of that journey. We've enabled people to be much more in ordinary houses, in ordinary streets. But actually, hang on a second, have we really enabled people to be a part of their local communities? Certainly some people, very much. As I walk around, as I talk with people, I see people with learning disabilities participating and involved. A guy at the corner shop, not the corner shop, but outside a cafe, or takeaway these days, we don't have cafes anymore, the other day, who I always see, talk to. So I think we've done that for some people, but for so many people, they're still absolutely cut off. They may be living in ordinary streets and ordinary houses, but they're not fully participating in things. And I think we've, rapidly during the pandemic, we've seen the potential of that. I was shielding for 10 weeks. The support that I got and I got to know my neighbours better in about 3 days, even though I couldn't see any of them directly, than I had done in the previous 25 years. I think we can galvanise and use that for people with learning disabilities. And we don't need to wait for a policy document. Action can be taken locally. It's not a matter of law, but it can be supported or not supported through the overall framework that's available to people, through what universal support is available. Jim and Scott talked about the 150,000 people who are on the GP register. Well, there's a similar number of people that use adult social care services, a little bit lower, but there are, as they point out, 1.2 million people with learning disabilities. So it's really important that there's that vital community support available to other people, preventative support and so on. Many providers are already doing a great job in this. I think the young woman I met who was facing all of the sort of challenges and dilemmas and issues that many young people face in the society, but was being supported really, really well in her own flat, surrounded by people that she cared about, in order to take her own path. I think of a young guy whose behaviour used to be thought of as very challenging, used to be in a hospital, now is well supported. He was talking about the holidays that he was going on. This is pre-COVID. We can do this. Whereas for other people, things just aren't like that, and there's huge variations across local authorities. So there's a lot of work that we can do, but we do need clear leadership, and there is a clear central government role in this. When thinking about social care reform, it's vital that it focuses on people with learning disabilities and autistic people and other people of working age. It's not just about older people, it's not just about care homes, and it's not just about the money, though investment is needed. So what do we need from government in this? I think we need a few things. I think we need them to join with us in articulating that vision for social care, in creating a new public narrative, because it's how it is that we talk about it and think about it that matters. I think in terms of legislation, we have the Care Act, which is a really good piece of legislation, but very poorly implemented. I think there needs to be real drive behind that. I think there needs to be a real priority given to prevention and early support. It's in the Care Act, but actually at the moment, local authorities feel so hard pressed that they can't pay for it. We need to put people's voices and put respecting people's choices and their rights absolutely centre. And that means investing in peer support, in self-advocacy, in independent advocacy, in support for family, in accessible information. Scott emphasised just how important that accessible information is for people. Central government and the strategies that it sets out need to help us to rise to the workforce challenge, and also and critically need to make sure that nobody is left out. So people that are just about managing until that bill lands, despite finding difficulties in life, autistic people who are still bounced between learning disability and mental health services, parents with learning disabilities who often have so many people involved, but it feels like nobody really on their side. I met remotely a couple of weeks back with parents of who both had learning disabilities, and it felt like every professional apart from their advocate was seeking to test them, but only their advocate was working alongside them to help them to pass those tests. So we need to make sure that nobody's left out. And finally, and it does need to come at the end rather than at the beginning, there does need to be real investment in decent social care for people, real investment in the workforce. And if we think about that, it is truly effective investment also in boosting the economy. When we pay decent wages to support workers, they're not going to be investing that in offshore accounts in the Caymans. They're going to be spending that. That's going to be helping as well as giving people the respect that they need. We need that rather than claps and badges. The second main area that I wanted to focus on was around transforming care and Mental Health Act. So 10 years after Winterbourne View, not nearly enough progress has been made. There's at least 2,000 people with learning disabilities and autistic people who are inpatients, many, many more if you take the mental health data set. And it may seem like mental health reform provides a way forward with this. And certainly the government has shown a really strong intention through their response in the Mental Health Act white paper that was recently published to reduce admissions of people with learning disabilities and autistic people to inpatient settings. And there are some really positive measures in that, creating a duty for commissioners to ensure adequate support in the community, placing care education and treatment reviews on a statutory footing, expecting that these are always carried out in advance of anyone being detained in a hospital, and that it's demonstrated that all reasonable, all measures have been considered and exhausted before somebody is in a hospital, requiring dynamic risk registers. So I think there's some really good stuff in the Mental Health Act white paper in relation to people with learning disabilities and autistic people and preventing unnecessary hospital admission. One of the most striking features in the Act, though, is changing the definition of mental disorder so that it excludes learning disability and autism for the sake of detention under Section 3. And that feels like and seems like a really good move. So taking away the inclusion of learning disability and autism so that people cannot be detained long term in that way. However, I think there's a very severe sting in the tail, which may be that those people are simply detained under the liberty protection safeguards instead. So I think we need to really get to grips with and understand whether the Mental Health Act offers as strong a way forward as it may look. In any case, people can't wait for its passage and implementation. We need change now. And I think some of the key changes that we need, again, it's around strong political and national leadership. Scott and Jim spoke about that in terms of some of the drive that needs to come from people with learning disabilities and autistic people and their families, and I completely endorse that. It needs to be backed up with strong political investment, so political will and leadership. It needs real investment in community capacity and capability. There's plenty of money being paid to people for people to be placed in poor hospital provision. However, there probably is a need for transitional funding and double funding for a period of time while community services are developed even further. It needs to be driven by better commissioning, by commissioners who prioritise and enable and support and plan long term based on what it is that people and families need. It needs investment in more effective advocacy for people in inpatient settings and people at risk from them, and it needs a more robust regulatory approach than is currently taken. So I think we must address this, and come on, if we can work our way through a pandemic, if we can build Nightingales in 9 days, surely we can sort out the support for a small number of thousands of people who are desperately, desperately in need of something better. I believe that we can. The third area that I wanted to focus on was the deprivation of liberties and liberty protection safeguards. As people will be aware, the Mental Capacity Amendment Act is due to be implemented in April 22. It may slip, but it's due to be implemented then. That affects around about 250,000 people each year for whom their applications made to deprive them of their liberty in their own best interest. So the examples are somebody needing to live in a care home because they're unable to support themselves safely in another setting. So extremely serious decisions about people's fundamental human rights that need strong safeguards. There's a major shift in the law due to take place from the deprivation of liberty safeguards to the liberty protection safeguards. It would take a full slot and probably a day to explain all of the differences, but suffice to say there are important changes ahead. The Act is not what we would have ideally wanted. We worked very well with other organisations to change it to something that was a lot better, but still overall on paper the safeguards it offers are probably weaker than the current arrangement. However, I think that despite that, it presents a huge opportunity that the current Act is not implemented well. We can make a new Act implemented much better. And there's a key area that I think can really improve on that. Where somebody's detained of their liberty, they absolutely have a continuing right to challenge that, and there's a duty on the state to support that person, to understand that and to make that challenge. So they need to have somebody on their side that can speak out for them, that can express their views. And the changes to liberty protection safeguards makes it really clear that in the majority of cases, the person needs to have support from an independent advocate, either directly or through their families. That's not happening at the moment. We can make that change so that more people have somebody really on their side when it's being considered that they may be detained of their liberty or when they are being deprived of their liberty. We can make that happen if we work well with government to make sure that the money that's set aside really does flow to local authorities, work well with local authorities to make sure that it really flows in to provide that support to people through good advocacy and good support to families. But we need the help of other professionals to do that. And the key help that we need is to make sure that where people are entitled to advocacy, they're always referred to it. And I can talk through perhaps in the Q&A when it is that people are entitled, because it's not as clear a picture, and I think I can probably make that a little bit clearer and give some rules of thumb if people want to ask about how it is that you get an advocate. So those are three key areas that I think we can make some real progress and real ways forward. And I think law and policy helps to set a framework where we can better ensure that people have strong voices, rights that are expected, and better lives. But what it ultimately comes down to, and again, I think Scott and Jim nailed this, it's about relationships. So I think there's something that we can all do here. I think there are three really key things that we need to focus on, 3 really key questions. How is it that we help people to build connections and relationships? I think that's a job for all of us. How is it that we support people to have a voice and ensure that rights are respected? And how do, as a part of that, how do we support people to get independent support, to get the advocacy that they need through this? And thirdly, how are we supporting, motivating and encouraging people, families, ourselves and our colleagues? Because this is still a really tough time and we need to get all of the motivation, all of the energy that we need. We need to celebrate success, and it was great to hear about the heroes that are being proposed. I think, through the pandemic, I've been inspired not just by the response, and there's been tremendous response by provider organisations and others, but by the leadership that's been provided by people with learning disabilities and autistic people themselves, who have shown such resilience in their own lives through this time, but also have spoken out increasingly nationally and in the media about how it is that we can build better lives for people. So I hope that people with learning disabilities and autistic people are strongly nominated for those hero awards. I think they've shown us that in face of all of the challenges that we have ahead of us, we can build a better future. I'm certain that we can do. Thank you.
Thank you very much, Jonathan. I'm certain that we can do too. Can you hear me now before I continue? Just, Jonathan, if you nod, I can see your face. Yep. Can you hear me? Great. Thank you. Thank you. Apologies, everybody. I don't know what happened with my signal. It temporarily stopped. So before we come to any questions and answers, if anybody's got any questions for either Jonathan, Jim or Scott, put them in the Q&A. But before we come to those questions, we're just going to track back to Cecilia, who's now with us. And Cecilia Annim is the former president of the Royal College of Nursing, and would like to share a few words with us. Thank you, Cecilia.
Hello, good morning, and thank you very much. Can you hear me? Yeah. Okay. I just want to start with my story about how I have spent the lockdown pandemic with my daughter, Ruth Annim, who has got learning difficulty. We have been for walks, have been for hospital appointments. We have worked harder than before to get my daughter to take her medicine. Sometimes she's increasingly vocal about the things she wants and does not want. My daughter Ruth is a person why I am so passionate about learning disability. She's nearly 30 years old, charming and funny, has consistently beat the odds to survive. She has the reason for my passion. Every day I see learning disability nurses use their skills and insight to help create a better future for Ruth and others like her. They perform a vital role in tackling health inequalities, which have inevitably worsened and deepened since the start of this pandemic. The pandemic has opened up the gaps in delivery of care from staffing, recruitment and retention, insufficient resources and care staff. We need to address these, and you have heard from speakers and you will hear more of what needs to be done. This puts more pressure on current staff even before the pandemic, and ultimately means that some of the most vulnerable people in our society will be less able to access the care and treatment they need. This is a critical situation. It's simply not good enough. Learning disability nurses are a very important part of the nursing workforce. We need to get the care right. We need to give care at the right place. We need to involve the person with learning disability, carers and family. The right support in social care, health, and also in education requires skilled staff to prevent inequity in these aspects of their care and well-being. The question is, how long do we have to keep talking about this, about requiring and delivering the basic care for the most vulnerable people in our society? The rhetoric needs to stop. We demand action now. We are all aware of the gaps and the lack of inclusion the pandemic has exposed in care provision and decision making. We need a fresh pair of eyes to address these gaps. Support one system healthcare approach that no one is left behind. I want you to join me on this journey. Think about care for a sustained and inclusive right to service provision for people with learning disability. Let's stop learning the lessons without action. The lessons must be backed up by action. This is a call to all of us today to lobby and demand this change and be the voice of people with learning disability and their families. The talking must stop now. Thank you very much, and sorry I was late in joining.
Thank you so much, Cecilia, and I certainly stand with you, and I'm sure many of our people that are joining the conference today do too. We've just got a couple of questions from the audience that I'm going to share with the panelists. So if I could just bring the first question to Jim, I'm going to try. So Jim, how do we ensure people with a learning disability are registered with a GP? And I'm going to combine that with the next question, which is linked, in that are GPs the best network to support people with learning disabilities at all? And Daniela has pointed out that so many people face issues with getting through to the GP, let alone those GPs being support needed for someone with a learning disability.
Yes, I think it's a good question. I do believe that GPs are central, and I think where you look at it in places like Norfolk and Norwich, what you'll find in that sort of region where they have learning disability nurses embedded within primary care, you find a greater uptake and a more effective register. And I think what's beholden on everybody that is on this call, you can do something today, not tomorrow, but today. Everybody you support, everybody you know, every family member that you know, make sure that they're on the register. Make sure that they're on the register with the GPs. Make sure that they're known to their acute hospital, general hospital providers. That is vital. Don't wait for GPs to do it. Although GPs can help, we need to support and engage with them to enable them to do that. And the question, so yes, I do think they're key, but I don't think they're only key. I think also what we need to do in social care, where an awful lot of learning disability nurses work, there are only about 3,500 learning disability nurses working in the NHS currently. Yet there are 17,000 learning disability nurses on the Nursing Midwifery Council register. So where are they working? Largely in private and in social care settings. Make those learning disability nurses active as learning disability nurses, the heartbeat for health gain and health change. And there are fabulous examples. We'll hear some from Dimensions later on, but also McIntyre have done some great stuff around health and well-being, creating innovative posts for learning disability nurses in relation to dementia care within their practice settings and their provider arms. These are excellent solutions, and we need to make sure that these become more embedded. And the other question I think you're going to ask me, so I'll just preempt it, Catherine, is about why are there so few learning disability nurses? Well, that's because we don't advertise the key roles of what we do. And sometimes there's a bit of a blurring. The 5 key framework principles that I gave you earlier, those are the things that learning disability nurses can do across and within health, social and education settings, regardless of what sector that is in. They can do those things. That's what you should be purchasing. That's what we should be driving forward for. And we need to have the lived and living experiences of people with learning disabilities and families who have experienced learning disability nurse care actually drive that forward. And that is what really will change the profile of learning disability nurses. We need to invest in advertising, but we need to be very clear, what is it we're asking for? That's why I'm saying the Give Me 5 is the heartbeat of change. Without it, we'll see nothing different. So that's my brief summary, but it's an excellent career. If you're thinking about it, please get in touch with me.
Thank you, Jim. Jonathan, I'm going to try you for the next question, and we might see if any of the other panelists know the answer to this, but do you know if there is an evidence base for the use of telehealth with autistic adults or people with learning disabilities? And are we dependent on what we've learned through COVID experiences, or are there more to draw on? Sorry, Jonathan, you're on mute.
Sorry, schoolboy error. I'm not sure what the evidence base is on it, but obviously it's of increasing importance. I think what we've found through the pandemic is that there's probably broadly three groups of people. There's a group of people who actually have been managing with remote technology really quite well. A second group of people who, with the right support, can do so, but need that right support. And a third group who it's really critical don't get left behind because they just cannot use virtual remote stuff. They really do need face-to-face support, and it's so important that people with learning disabilities and autistic people are not increasingly discriminated against through digital by default ways of working, but instead can truly take advantage of the real benefits that there can be. And I'm sure we're going to hear some more later on from Dimensions about what some of those benefits can be, but we've got to make sure that people are brought ahead rather than left behind.
Great, thank you. And on that nice link there, Jonathan, we'll move on to Dimensions. So we have next, we have Rachel Dodgson, who is the Managing Director of Dimensions. Rachel's worked in social care for over 30 years as a qualified social worker and has worked in a wide range of roles. So over to you, Rachel. Thank you.
Thank you very much. Good morning, everybody. Nice to be here. So I've got a broad title, Innovations in Social Care, Things We'll Be Keeping. And I could really bore you all to death with talking about things we're changing in terms of internal process as a result of the pandemic. But instead, I thought I'd try and cover a broader range of things that I hope will connect with some people in terms of your experiences, but also some things that you might find interesting. So I'm going to talk a bit about how we've managed through the pandemic, how we've recognised people's contributions or tried to do that, how we've made the best of technology during this period of time, and lobbying and the future, and probably some other bits and pieces in between. This is quite a busy slide. Now, I'm not going to talk through every box on here, but I wanted to just set out how we started to manage during the pandemic. And what we realised is that we had to manage really differently. Dimensions is a big organisation. We support 3,500 people with learning disabilities or autistic people, and we have 7,000 colleagues. So we're a big organisation, and we operate a devolved structure where the regions make a lot of decisions and we control very little from the centre. What we realised very quickly was that we had to manage the pandemic in a very different way. So we established a battle rhythm. And a battle rhythm, if you look at a definition, there's lots of definitions, but one definition is a daily routine or order of business, especially as assumed by a military organisation or during a crisis. Well, for me, and all my years in social care, this pandemic was certainly the biggest crisis that I had ever seen in the sector. I was reflecting this morning, we set up very quickly a pandemic emergency response team that had a number of key people on it. We had our first meeting of that on the 13th of March last year. In the first, 4 to 6 weeks of that pandemic, that team met every day, 7 days a week at 8:15. And we got into a routine where we would get an overnight briefing from our public affairs people about what had happened the day before in terms of government guidance, the things that were coming out. We'd have our agenda, we'd get comms out that day. So we quickly got the organisation to a very clear rhythm of how things would work. And I was reflecting this morning, that first meeting was on the 13th of March, and we are now on action number 1,977. We have an action log, and that's where we're up to. I just thought, wow, that just really shows the kind of year we've been through. So we quickly really geared up our comms, making sure we had regular internal comms, one for all our colleagues, one for managers, and family communications. As people remember at the start, that was so challenging because government guidance changed all the time. It was really difficult to keep up with things. We were really clear that at times we'd need to move away from our normal policies and decision-making processes. So we made sure we recorded all of that. So if things ever came back to us in the future, we'd have our audit trail for that. I would say the organisation really welcomed some more control being taken from the centre and having a more centralised decision process and clarity about what we expected for people to do. We really raised the profile of our chief exec, Steve, by making sure he sent out weekly messages to colleagues as well as communicating with families and people we support. The other thing that we learned really quickly is that we needed to have lots of good data. I'm a believer in data. I think it's not the only way that you know what good looks like. You have to get out there and see it for yourself. But actually, we need those key things we needed to keep track of to know that we were managing the organisation well and what was happening. So we developed really quickly some data dashboards around things like sickness levels, hospitalisation, PPE stocks, which people remember what that was like in the beginning. That was really challenging. Cash flow, agency level, so all sorts of things we're tracking and getting updates on a daily basis, so we knew what was happening in the organisation and we could take the right decisions to run the organisation well, especially during those early few months. I'm glad to say that the PERT team now, we meet once a week rather than 7 days a week, so it just shows how things have moved on. The other thing we did was we really explicitly started to plan for recovery. So we had a programme of work that we called the 6 R's, and this was about us probably 3 months into the pandemic thinking, what about coming out of this? How do we get the organisation, the people we support and our colleagues through the other side of this? So we had a programme that considered 6 things. So resumption, so when we'll be able to resume things like people like me getting back out and visiting people we support, opening offices, face-to-face training, all those sorts of things. Reconciliation, so how would we thought things might happen during the pandemic that would be things that we wouldn't have necessarily wanted to happen. Ways of working might change, people might become complacent, so a programme of work about how we'd reconcile some of those things that had perhaps slipped in a way we wouldn't have wanted them to. A programme of work on recognition and recuperation, so how we were going to support our colleagues to know that we recognised them, that we were grateful for all they'd done, because people just blew me away in terms of going the extra mile, and how we were going to help people recuperate and come through to the side of this. Reflection, so reflecting on actually what out of this do we want to keep, which is some of what I'll touch on in a moment, and actually what are the things that we not want to keep and we'd want to go back to the old ways of working. And then reset. So how do we reset the organisation? How do we get back to the place that we were before, although that might look different? And how do we maybe reform things as a result of that? So that's kind of how we managed and what our vision was for going forward, although of course we're still very much in the middle of a pandemic. We did a lot of work around digital inclusion. So really quickly, the impact on people we support of not being able to have visits and face-to-face contact with people that they loved and their friends and families, we knew was going to be a big impact. So we invested in buying tablets, and by that I don't mean medication, I'm sure you realise that, but tablets that would help people to keep in touch with people electronically. And I know that's not a panacea. It's not how we want things to be in the future, but it really did help. It helped those connections and it helped people stay in touch. It had a real impact on relationship maintenance. There was a lot of barriers around sort of digital skills and work we had to do with people we support and families to help them get on board and to understand how to make those engagements work, but we had quite a lot of success with that. It threw up some challenges, Wi-Fi coverage in some places, whether we're really responsible for providing IT kit or those sorts of things, but we just did what we thought was the right thing to do at the time. We, yes, I've moved the slide, sorry, so staying in touch groups. We have the people we support, we've got a digital council of people we support in the organisation, and they set up lots of staying in touch groups for people. We had things like a Saturday morning football club, Christmas Day, people got together for a drink and a chat on Christmas Day morning, all sorts of chat and friendship groups really took off to help people stay in touch and to try and stop people feeling isolated and lonely, particularly people that might have lived on their own and only got a few hours of support from us, say, a week. And the council that I just talked about, that's generally a face-to-face group of people. They do some really great work. They help with our campaigns and lobbying. They've had to move to a digital way of working, and that's been great in some ways because actually people can get there more easily. But there's also been challenges, again, the IT issues and things like that. And I think when we come out the other side of this, that group will probably meet face-to-face once a year, perhaps, and three times virtually. And I've put a pause for thought on there, and I've used the term challenging behaviour, which I don't like, but I know it's recognised. I'm on a mission to change it to behaviours of distress. But we did see a real reduction in some of the people we support who can present with behaviours of distress and be upset. We saw a real reduction in that during lockdown. And when we've looked at that and we've looked at the evidence, it seems to be about the daily pressures that were taken off people. Some of those stresses were removed. But for us, we're also thinking, well, what does that mean coming out of the other side of this? How are we going to help people get back to those things that they used to do and lead the lives that they want? And for some people, they'll want different lives. And it's how we support people to do that too. I've talked a bit about technology, but to say a few more things, we've always been big on management presence in Dimensions. So me in my usual working week, our working month, I would get out and visit at least 10 places where we support people every month. Unannounced visits to pop in, where I'd connect with people we support, see how things are, and talk to colleagues, and my other executive team colleagues and senior managers do that too. I've been doing virtual visits, doesn't work with all the people we support. For some people, it's really hard to engage in that way. And it's, in some ways, it's staged. You're not seeing how things really are, but it has meant that I've at least felt I've been able to connect with people throughout this and understand how things have been for people. And similarly, virtual coffee mornings. So I've got together groups of support workers from across the organisation, from across a particular area, had a cup of coffee, chat, how things are. It's been a chance for me to say thank you for what people have done, but also to really understand how things have felt on the ground for people. So for me, that's something I'll probably continue going forward, because actually it means I get to meet a group of people in a lot of ways, but I am getting back to going out doing my visits. My virtual service visits will not be something I keep. Virtual person-centered reviews. So we've seen some really great examples of how we've managed to run things like reviews for people on Teams. Other providers here will have had the same experience, I'm sure, but just really creative ways of making sure we're helping people to keep an eye on their goals. There might be different goals, things have changed people during the pandemic, but really keeping an eye on that and making sure we're looking at that with people. And some really great support about individual outcomes. So, you know, lots of examples that I've heard from people about how we've supported some people to have the vaccine when that's been really difficult for some people. So lots of great work on social stories, lots of great work on vaccines happening where it's comfortable for people. So you've got somebody who wanted his vaccine in the bath because that's where he wanted it, that's where it felt comfortable. And so that's what the nurse did. Just some really great things about how we've tried to help people get their health needs met in a very different world. And savings on office space, I'm sure that's a pretty obvious one for a lot of people here. Going forward, we will really reduce our estates because we've realised we can work in a very virtual way. We can spend our money on better things, I'm sure. So that's something that we're absolutely going to keep. I want to say a bit about outstanding contributions, because without this, we would not have got through this, I'm sure. So we've had record lows for colleague sickness. The way that teams have pulled together across this pandemic to support people, to keep people well and safe, has just been, it's been mind-blowing, to be honest. It really does blow me away when I see and I hear about the extra miles that people have gone. We have recognition awards, and the nominations for those have gone through the roof. We had a nomination for somebody that that works for us, who spent 2 weeks living in a mobile home outside where he works so that he could keep supporting people rather than risking going home, getting sick and then not being able to come to work. And that's just one example of many that I could tell you about some of the fantastic things people have done. We ran a campaign called Corona Heroes, and I'm going to talk about a couple of those stories in a moment. But we wanted to really make sure there was public recognition for people making a difference, and we threw some campaigning in there too. I do think this has been a time when social care has come to the forefront. It's a time when actually people are seeing the benefit and what social care can really bring. So we've just really trying to take advantage of that and build on that. And our rock stars, and again, I'm going to give a couple of stories of that in a moment, but that's our recognition of outstanding contribution stars, and that's for the people we support, and it's by the people we support too. They nominate people, and we just had some stories from there that have been fantastic in terms of what people have done during this period of time. And I have put on there about vaccinations for new starters. It's a kind of slightly odd place for it to sit, but we are really clear that we think the vaccine's important for the people that work for us. It's important that we keep people safe, the people that we support, and we keep them well. So we have taken a decision that for anyone that starts the new starter with us, we will say actually it's an expectation when you start to work for Dimensions that you have the vaccine. And we're doing a lot of work with our colleagues to help them understand the benefits of having the vaccine. So just I thought it was worth pointing that out. So here are some of our Corona heroes, and it's not all of them. As you can imagine, I'm not going to go through all those things on those slides. You'll be relieved to see, but there was just so many fantastic stories, and I just want to pull a couple out. So this is Jessica and Kaylee in Ipswich, and they decided to make their window the most colourful in the street and put up a new joke every fortnight to keep spirits up. I struggled to see the joke, but I'll tell you it in case you can't see it. So it's, what's the difference between Dubai and Abu Dhabi? Dubai doesn't like the Flintstones, but Abu Dhabi do. So anyone who's a Flintstones fan, I'm sure that will ring a bell with you. But they were really keen to try and contribute something to make other people in the community feel happy as we were getting through certainly the early days. This is Richard. He's a support worker in West Berkshire, and he asked Morrison's to donate 60 Easter eggs, which they did, and he went out and delivered one to every person we support and every person that works with him in his area. Another great story about Richard is that he challenged a doctor's decision not to have a face-to-face appointment with someone. Other people have talked about this. I think it's been really difficult for healthcare during this period for a lot of people, because actually some people do need face-to-face appointments. Digital doesn't always work. So he challenged a doctor and said, this person does need a face-to-face appointment, you need to make that happen. And he got an apology and a box of chocolates from the surgery because they actually recognised that he was right. And it's so important to me, that work that our frontline colleagues do in challenging those decisions and those medical views sometimes. And it takes courage, because actually it can be quite hard to stand up to a professional. So those things just really inspire me. And we talked a little about community connections and community contributions. So here again is some of our Corona heroes. So the connections that we made early on with local communities in terms of PPE, people remember what that was like at the start. There wasn't PPE, it was a real struggle for all of us, for all providers. So actually the way that we worked with local communities, and the way they worked with us to really help with PPE. So we had dentists giving us what they'd got. We'd got schools and colleges making visors and face masks and all sorts of things. So for us, those community connections are something that we will build on. It's something that's really, I think, been a strength of the pandemic, not only for the whole of society, but certainly for people with learning disabilities too. So there is a silver lining on some of this, I guess. So we'll certainly be looking forward to building on that and taking that forward. Again, some of our recognising outstanding contribution stars. I'm just going to pull a couple of stories out here. So the top one, it might be hard to read the words, but Mark was really poorly. He's someone we support, and he was in an induced coma with COVID for 4 months in hospital. And he returned home when he got better, and he's since delivered a talk to the NHS about how COVID is and about the recovery process. And now he's got a paid role delivering that talk to a wider audience, which I just think is fantastic. It's just such a great contribution, such a great recognition of what Mark can offer in terms of helping people learn about things. And Emma is somebody who's worked for us on our Autism Friendly campaign. So she's done a lot of work with libraries and museums to get into be more autism friendly environments. And she's just always smiling and always cheerful. So she's just generally fantastic. But that's just a couple of our rock stars. I could tell you about a lot more of them. Something else we've tried to do during the pandemic is really accelerate our lobbying. So we had a campaign about can't wear a mask that got quite a lot of publicity, and certainly some of the autistic people we work with and other people, that's been really difficult. So we had some success there, and that was a really good campaign. Supported living. There's a real issue about supported living not being recognised. I think that's always been a problem, but I think the pandemic really brought it to the forefront. So actually all the way through this, guidance came out for care homes, all the PPE, anything the government put out was all about care homes. It's, hang on a minute, over 90% of the people that we support in Dimensions, of the 3,500, live in supported living settings. And it seemed to me that group of people got left behind, it got forgotten about. So we've done a lot of work around lobbying for that and really trying to get that up the agenda. The Do Not Attempt to Resuscitate, and CQC clearly published a report on that last week, but we had several examples of those being inappropriately applied on somebody. I was, as an example in the organisation, where somebody who had got a diagnosis of dyspraxia, asthma and a learning disability had a Do Not Attempt to Resuscitate order placed upon them without any discussion with their family, nothing else. It's entirely inappropriate. We challenged it, we got it changed, but we have several examples of that. All of that was successfully challenged, but the way that has been throughout the pandemic was problematic, certainly at the beginning. More than problematic, it was outrageous. The vaccination, we did a lot of work around lobbying for that, particularly we know that with people with learning disabilities are 6 times more likely to die from COVID. So we did a lot of work around the vaccine, and I think it's disappointing that as a society we had to wait for some celebrities to get involved in that campaign to really change things. PPE, everyone knows the ins and outs of that. I won't go into it, but we tried to do a lot of work around lobbying for PPE and raising awareness around that too. And then key worker shopping times. So early on, there was slots for nurses to be able to go and do their shopping at certain times. We lobbied for that for social care too, and were successful. So writing to all the big supermarkets saying, hey, don't forget about social care. People there are playing just as important role in this pandemic and keeping people safe. My last slide, just some things that badly need to change from our perspective still, and this resonates with things that other speakers have said this morning. So return to face-to-face health checks. I've said it already, it doesn't work for some people, those virtual health checks. People can't pick up on things in the same way. So that's, from our perspective, something that needs to happen really quickly in terms of returning. We think it's great. We've got a sector that's speaking with a single voice. As I said already, social care, for the first time in a long time, it seems to me, is really at the forefront of people's minds and on the agenda. There's lots of different campaigns. It's great that there's all these campaigns, but wouldn't it be great if we could get a strong voice on perhaps one or two? So we've got a single voice and we're really lobbying for the things that the sector sees as the significant issues and trying to get change on that. The supported living point I've touched upon, but really policymakers have got to take the learning from this to understand what the difference is and what the impact of how policymakers have treated supported living during the pandemic has been, because it's been significant. The latest thing is things like visitors, obviously. So actually, if you live in a care home, you can have a visitor. If you live in a supported living setting with a group of other people, then you still can't, because it's just the understanding of government about actually the needs of people in those who live in those different settings isn't always that different, and there's just got to really understand the impact that some of the decisions have taken has had on supported living. And the manifesto commitments, you know, the government needs to rise to action on things it's talked about doing before. So I'm going to stop there. That's probably my 15 minutes. It was a bit of a whistle-stop tour of things, but I hope it was things that were of interest to people and resonated with people. Like I say, I strayed a bit from my brief, but I wanted to make it varied. So thank you.
Thank you very much, Rachel. Can you just give me a wave if you can hear me?
I can.
Yeah, great. My sound's still working. Fantastic. Thank you. If anybody's got any questions for Rachel, put them in the Q&A and we'll come to them after we have heard from our next speaker. I'm really delighted to introduce our next speaker. Yvonne Newbold is a parent and a campaigner. She has quite a long bio, which I can't read out, but it's so impressive. But she's crucially a mum to 3 now grown-up children, including Toby, who has a profound learning disability, complex medical needs and multiple disabilities. He also has a history of violent and challenging behaviour, and it took Yvonne 8 years to access the right help, support and information to gain the skills and knowledge to support Toby beyond these very difficult times. He's now a very happy, engaging young man with a great quality of life. Yvonne is also living with stage 4 terminal cancer and has been having treatment since 2012. And her bucket list project is to support other families of children with additional needs who have also anxiety-led violent behaviour episodes. And as I say, there's a lot more I could tell you about Yvonne, but we don't have time to. But nevertheless, it's incredibly impressive. Welcome, Yvonne.
Thank you very much. That's a lovely introduction. Thank you, Catherine.
It's a little bit crackly, actually.
Oh, God. Hold on. Is that better?
Sounds a bit like a Dalek, unless it's just my system.
I don't know what that is. I'll mute myself and unmute again and see if that makes a difference. Is that any better?
Some people
Not really, Yvonne. Maybe if you can go a little bit closer to the microphone.
Is that better?
Oh, not really. Still quite clunky.
Technology is proving a challenge, isn't it?
It's dial. What do you think?
You could try that, yeah. You could dial out and back in. Give that a go.
Right, so I'm leaving and I'll come straight back in. Thank you.
If anybody's got a question for Rachel or for any of our other panelists in the meantime, do feel free to add to the Q&A.
Just to say, Rachel, I completely, my camera's gone weird, but I'll turn that off. Just so I completely agree with the points that you're making about how important it is for policymakers to truly understand supported living. as a result of some changes that took us a couple of years to achieve. My sister's home was deregistered just at the very beginning of the pandemic, but of course it was still exactly the same in some ways as it was before. She still lived with 3 other people. She still got support from support staff, but there was so much less information available because it was now supported living, even though in lots of ways, and the cultural change that would help to get a new organisation in to provide made a much better setting for her, much better support for her. But yeah, loads less guidance because just wasn't written for supported living. So completely agree with the points you made, Rachel.
Thank you. Yeah, it's
It's been a
just
massive challenge, hasn't it?
yeah, absolutely, and it's still there, and it's just so many people. As I say, much more people live in supported living. That's the modern model of support, and it's just it's been so difficult. The competing guidance, changing positions from the government, etc., etc. It's been really difficult.
We found the similar with people who receive support in their own homes as well. You know, if people have a personal assistant or very, very similar needs, but don't have guidance that's been appropriate to them, it has been a challenge. Hopefully a lot of those lessons have been learned for the future, but it's a shame we have to go through that to get there.
Yeah, I think we still have quite a lot to do to drive them home, so that when we are sort of working with government and others about what social care needs to be like in the future, we still need to really hammer home the message that it's so very, very much more than care homes for older people, as important as those might be as a part of, you know, one part of a much bigger picture.
Absolutely. I think we've got Yvonne back. Yvonne, do you want to try again?
Hello, is that any better?
Spot on, brilliant. Thank you.
Okay, thank you. Okay, I'll speed talk now because I've probably kept us all a bit late because of that, sorry. First of all, I'd like to say a huge thank you to the lovely people at Care Talk magazine for inviting me to take part in today's conference. As you probably heard from Catherine, I'm not a professional, I'm a mum to 3 grown-up children. So I'm going to start by telling you a little bit more about our story. Now, basically, here are Francesca, Toby and Adam a very long time ago when they were still very cute. Toby's the one with the curly hair and the orange jumper. He's my middle child and he was born with a condition that's so rare he's the only person in the world that they've ever found with his particular syndrome. It made him incredibly ill when he was little and he spent nearly all of his first 6 years in hospital, with me always staying with him as a resident parent, watching helplessly as he lurched from one medical emergency to the next. I lost count how often we nearly lost him, and it was made very clear that he was unlikely to live very long. This is what my 3 look like now. Against all the odds, Toby is now 26 and he lives in a wonderful house less than a mile away from us, and he'll always be the heart and soul of our family. He's non-verbal, with a severe learning disability and lots of other disabilities and medical conditions. He's also autistic, and intellectually he functions at about the same level as a mainstream 2-year-old. He loves life, he's got a huge personality, he's funny and engaging, and he's also the very best pickpocket I've ever met. His speciality is stealing your mobile phone just on the off chance that you might have YouTube where Mr. Tumble lives. As Toby got older, his health improved, but his behaviour escalated to frightening levels. The first time he hit me, I was shocked, but I thought it was an accident. This wasn't my Toby, but it was. For the next 8 years, Toby's violence dominated everything, and those years, looking back, were bleak, desperately sad, and filled with terror and unpredictability. As you can imagine, Toby had a fabulous team of professionals around him. He was at a great special school. He was under 14 different paediatric consultants, and he had every single type of therapist he could possibly think of working with him. I asked everybody for help, but nobody knew what to do. Help wasn't there. We were on our own. And very soon the narrative changed. It became my fault. Parent blame destroys families, and it nearly destroyed us, and I've seen what it does to hundreds of others. We finally got help in the end when he was nearly 18. Within a few weeks, magic began to happen. By the time his birthday happened a few months later, he was happy, calm, and it was safe enough for us to have a huge party. It was one of our best days ever. Toby owned the room. He grinned from ear to ear. He hugged people non-stop. This is the same young man who only 6 months earlier had needed a 3-to-1 if we went out with him. For the first time ever since Toby was born, everything was great. Things were looking really good. Everything was going brilliantly. 5 times after Toby's party, though, our world came crashing down, and out of the blue and unexpectedly, I was diagnosed with bilateral breast cancer. A completely different cancer on each side, totally unrelated, just really bad luck. So life went on hold while I had some tough cancer treatment. And when I got to the end of the treatment, sadly, another bombshell was waiting for me. Basically, the treatment hadn't worked. The cancer had spread to my spine, and the goalposts had radically changed. I needed to know how long I was likely to live for. I knew I had to make some pretty difficult decisions for Toby's future, and that's why he doesn't live at home with us anymore. They told me that if I continued on treatment, they may be able to prolong my life for another 2 years if things went really well and I was really lucky. Last week, it was the 8-year anniversary of that conversation. I'm still on cancer treatment, but life is very good. I think it must be because I take after Toby. That day, I knew I needed a bucket list. I wanted a sense of purpose, and I wanted to do something that mattered with whatever time I had left. There was only one possible bucket list that meant anything to me, which was to do whatever I could to make things better for the next generation of children like Toby and for their families. And that's basically what I've been trying to do ever since. The first thing I did was I wrote a book, the Special Parents Handbook. I felt this overwhelming responsibility to capture all the things I'd learned along the way about being Toby's mum, in the hope that maybe one day someone somewhere might just read something in it that might make a little bit of difference. I basically tried to write the book that I wish someone had been able to give me on the day that Toby was born. What I certainly never expected was that the book would become an Amazon #1 bestseller. And from there, the success of the book led to invitations to speak at medical conferences, which then developed into designing and delivering training workshops for parents and professionals. I ended up being invited on TV. So far, I've been on BBC Woman's Hour, Jeremy Vine, Victoria Derbyshire, and Eddie Nestor. Eddie has been incredibly supportive of the work that I do. He does the Radio London Tea Time Drive Time programme, and I'm now a regular on his show talking about the issues that affect our community. But the work I'm most proud of is the work that goes completely unseen, supporting a community of families. Sorry, I flew too fast through the slides. Supporting a community of UK families who have a child with additional needs and who, just like Toby, also has anxiety-driven extreme behaviour that means they lash out physically towards other people. As part of this work, I run a private Facebook group which now has 7,500 family carer members, supporting each other and learning together how to better manage a highly anxious child's most difficult behaviour. It's called the SEND VCB project, and that stands for support. It stands for Special Educational Needs and Disabilities, Violent and Challenging Behaviour. Every single family has a child with additional needs in the group who is also physically violent towards other people. Ages range from 3 to 18 and about a third of them are girls. Most of the group's children are either autistic or they have a learning disability or both, but there are lots of other conditions represented within the group. They're educated across a mix of settings, including mainstream, specialist or residential school, but a huge amount of them are home educated, not out of choice, generally due to repeated school placements failing or because they can't find a school to meet their needs. Violent and extreme behaviour in children with additional needs does not discriminate. It cuts right across every socio-economic group that there is. Within our group, we have professional members, including hospital consultants, head teachers, barristers and social workers, who are all parents dealing with this, as well as some of the most vulnerable families in the UK. However, they all have so much in common, including courage, tenacity, resilience, and a motivation and an unwavering love for their children. And then, of course, the pandemic happened. These families were already perilously close to crisis point. And it's no coincidence that our membership has nearly doubled in our group in the last year. Now, for me, that meant that I was suddenly locked away at home, shielding because I'm extremely vulnerable. And I'm only allowed to leave the house to go for cancer treatment. But worst of all, I can't see Toby. And it really does feel as though the heart has been ripped out of our family. But it's so much worse for him because he has no idea why he's not allowed to see mummy or to come home. However hard it's been for me, though, it's been unimaginably harder for the families in the group I support. Overnight schools closed, services and support stopped, and all the teams around their child in health, social care and education were either sent home, furloughed or redeployed due to COVID. Thousands of families feeling utterly lost, abandoned and desperate, coping with terrifying daily anxiety-driven violence from their children with additional needs or disabilities. Like many others in my community, I wanted to do whatever I could to help. That's where the series of 16 webinars that I now do developed from. All 16 in the series explore a different aspect of extreme behaviour in children with additional needs. There wasn't any funding whatsoever, but that didn't matter. We just did what we had to do. During the pandemic, I have now presented over 100 webinars for parents and professionals on SEND behaviour-related topics, which so far have been attended by over 15,000 people. I'm also in the process of launching a non-for-profit company called New Bold Hope. I'm now also on several NHS national policy and strategy boards, including being a member of the NHS Assembly and the lead in National Independent Advisory Group, as well as others with a focus on learning disability, autism, challenging behaviour and health inequalities. The webinars are changing lives. Last week alone, I had 70 messages and emails from families to say thank you and to share how well their child is doing and becoming calmer, happier and more settled. So far, I know of 800 success stories where children are happy and feel safe now. That really is the bottom line, because happy children seldom need to hurt other people. I do this work because we were once one of those families, as you know, and it took me 8 years to gain the skills I needed as a parent, and I just don't want any other family to ever have to wait that long. I'm not unique, though. I'm one of dozens of parents from our SEND community who's rolled up their sleeves and just got on with it over the past 12 months, doing everything we can to hold together the families who are on the very edge of the front line of the impact of this pandemic. We're supporting each other, and I'm very proud to be part of a consortium of 3 family-led small organisations called Frontline Families, set up especially to support the most vulnerable families within our community. And it's been great to be working with such heart-based organisations as the Challenging Behaviour Foundation and bringing us together. Here's just one of over 70 thank you messages from last week. The power of Yvonne's webinars cannot be underestimated. Since the pandemic started, my 6-year-old daughter has struggled with her mental health and self-esteem. She says she wished she'd never been born and has started self-harming. I've spent days phoning organisations desperate for help. I've been told she's too young to fit the criteria, or there's no service in our area, or the funding for a service that might have helped has now been withdrawn. Yvonne's webinars have given me back some hope for my daughter's future. Thank you for being there and for making the biggest difference. You are quite literally transforming lives for the better. Thank you. Now, it all happened here at my dining table, and I haven't even had to say it with slippers off once. It's been wonderful. Unseen and unacknowledged all over the country, people during this pandemic have stepped up to support our own communities with an understanding of compassion and insight that can only come from lived experience. We've held things together, and actually we've done it pretty well with some impressive outcomes. It has been real innovation in action. When services eventually open up again and things get back to normal, I will be over the moon to see Toby again. But I've got no intention of leaving my dining table anytime soon. Thousands of people have joined me on my dining table over the past 12 months, thousands more than I could ever reach in a meaningful way in live face-to-face events. These are families who can't go out easily, even when there isn't an official lockdown. Online means that I can turn up on their dining table too. It just works so well. We can't lose what we've made happen. There's been real progress. We're meeting the real needs of families when and where they need it the most. So what happens at these webinars? These are 5 of the most important messages I share with families. during our 2-hour sessions together. Oops, gone the wrong way. Basically, first one is don't think, how can I make a child behave? Instead, think, how can I make a child feel safe, secure, and happy? Tip 2, throw away the traditional parenting strategies completely. They're unlikely to work with this group of children. So don't bother with the sanctions, consequences, punishments, shaming, naughty steps, or stick chart, because they're just not going to work. Tip 3, and this is so important for parents to hear, I tell them to believe in themselves. You rock, you can do this. You're everything your child needs and more, but you can't run on empty. So you must look after yourself. Please be kind to yourself too, because you matter so much and your child has never needed you more than they need you right now. Tip 4, I suggest that they become their child's behaviour detective, looking for clues rather than triggers. And I also suggest they start with looking at sensory and communication issues, as well as how change and transitions are managed. Because in all this work I do, I get so much feedback from parents, and I reckon that 80% of behaviour episodes are rooted in those 3 issues. Tip 5, don't take any of your child's behaviour personally. All behaviour is communication, and right now their behaviour is shouting out for help. They're shouting loudest at you because they trust you the most in the world to be able to help. And it's because they love you and need you so much. Just one last ask, please. If you ever see a family that's really struggling, either with behaviour or in any other way, please just do everything you can to make them feel good about themselves. It's so easy to judge, and we barely notice that we're doing it, but it hurts. And the damage can last for years. Thank you. And also, just one last thing, I have a professionals group as well as a group for parents, the Community of Practice for the SEND VCB project, which any of you would be very, very welcome to join. Thank you.
Thank you, Yvonne. Just checking, can you hear me?
Yes, I can.
Yeah, great. Thank you, Yvonne. You are truly an inspiration and quite humbling. I found some of that quite moving. I don't know if I was supposed to, but I did. Really welcomed. We haven't actually got any time for questions, so it's not such a problem that we haven't got any, but I do just want to draw attention to some of the comments that we've had in the chat box. So, sorry, I'm just trying to reopen the chat box. I just closed it by accident instead then. That wasn't very helpful. But we've had lots of comments that are really thanking you for your work and talking about how inspirational you are. So I just want to draw your attention to that, Yvonne, and have a look in that chat box yourself.
Thank you.
Thank you, everybody, for attending our webinar today. It's been really, really fascinating. All of the panelists, thank you so much for your contribution. It's been really great. And I'm now going to hand back to Brendan to finish us off. Thank you.
Thank you, Catherine. Wow, what a fantastic array of presentations and speakers. I think in the video conferencing world we're in, it's a disappointment that there isn't a way you can give a standing ovation or show your appreciation for someone's talk, because I think it would have been used quite a few times on this one. Thanks to everyone who's stayed on the call. I know we've overrun our time slightly, but so we do appreciate you remaining on. I trust you found it a valuable use of your time. And thanks once again to all of our panelists and speakers. Really valuable for everyone involved to hear what you had to say. And just a couple of reminders again around what's coming up from a Care Talk and a conference perspective. So if we just take that slide back one, we've got the Care Talk conference in London on the 30th of June in association with Sky. The panelists and the speakers on that are speak for themselves, so please do have a look and get your tickets for that, and nominate. We've heard some fantastic stories, both personal and from an organisation perspective from Dimensions, all of which I think are an indication of the reasons why we should be nominating, so please do nominate for the awards. And finally, do take to have a look and request a copy of the Hayes salary guide on the link that's shown on the screen here, and we'll arrange to get that out to you. We don't have any events scheduled in the diary in the immediate future, but this is part of an ongoing programme for us. So once the next one's in the diary, we'll be sure to reach out to you and get you invited to that. But for now, thank you everyone who's taken part today, and we'll see you again at the next event. Thank you all. Bye now.